everyone, welcome to another episode of Keep It Wausome. We have a very special episode for you guys today. As everyone knows, the coronavirus really, the impact of it really ramped up this week, and businesses have closed. People are working from home. I was just talking about how people can't hold funerals, they can't hold weddings. There's been runs on the grocery stores. I went to Aldi on Saturday and it was like half empty. I've never seen anything like it. So I wanted to do this special episode for you guys to talk to an expert on the coronavirus and our local Marathon County. I've been calling her the coronavirus info czar. As you can see here, she's on the cover of City Pages. All our coverage is here, and you should really check out the City Pages this week. Almost our entire issue is devoted to the coronavirus pandemic now. And so with me today is Judy Burrows. Judy Burrows is the Public Health Information Officer. Did I get that right?
Yes, you did.
For the coronavirus. She did this the same thing for H1N1 and some other infectious diseases, but this one has to be kind of the most crazy so far. Would you say that's true?
Absolutely. I have not experienced anything like this. It's been a while since we did H1N1, so a lot of time has passed, but this is definitely a new and uncharted territory for all of us.
Well, can you start off by telling people a little bit about what you do at the health department? We're both outside when we're not in the middle of a pandemic, and then how that role changes when we do have something like this.
Sure. Typically, my role is I manage a team of people that work in the community on our community health priorities. So we look at behavioral health issues in the community and what systems we can do to improve that. We look at substance abuse issues and things like that prior to coronavirus were the top community health priorities. And any time that there's a epidemic, pandemic of a communicable disease, our public health department totally changes gears, and we become the response team. And so when that happens, then I assume the role of public information officer. And so it's my role to handle a lot of the communications out of the department. And so we tend to get flooded with questions, and I have a team of people that are working on how do we answer those questions for people.
And this way your role shifted, was it March 6th, did you tell me, or 9th?
It was about March 2nd when I started gearing up for it. And by the end of that week, I was reassigning staff to do different work in order to be able to respond to community concerns.
And so obviously this is your field. When you see something like this come up in the news early on, what were your thoughts on it when it started popping up in China? Did you think it would become what it has now? I was hopeful it wouldn't become what it has become. Sure. But every day as I watched the news and I saw it spread and I saw it spread some more, and then it was in other countries, and the further it went outside of China, the more nervous I started to get for the United States. And then it became it's only a matter of time before it's here. And indeed it is here. How would you explain what COVID-19 or the coronavirus is?
The coronavirus is a virus that it's a category of viruses, and most of the coronaviruses there are some that are in animals, and there are some that cause respiratory symptoms in animals. What is unique about this coronavirus is this is a new virus. This is what we call a novel virus. This is where a virus that previously existed in animals made the jump and was transmitted from an animal to a human. When that happens in the public health world, we all kind of stop and say, uh-oh, we have a problem.
Really? Okay.
And then it made the next step, which was even more critical. It was transmitted from one human to another human. So it's unique. It's not something that humans have experienced before, so we don't have immunity to it. And that's what's gotten us to where we are now.
Was that the same case with H1N1?
Similar, but yes.
It came from an animal and then spread to okay. And it supposedly, this outbreak started in China, and I heard that it was from a bat. Is that? Or is that kind of speculative at this
I
point?
think I don't think we know definitively.
okay.
But the first cases were identified. The common thread there was people in a market
It was in Wuhan,
where there were
China,
in the province of Wuhan. So the common thread there seems to be that market, and there's animal to human transmission that happened there. But I don't think they've definitively been able to say if it was a bat or a cat or what it was.
So a lot of people are saying, especially early on, I think this is starting to disappear. But people have been saying, "Oh, it's just like a flu, or the flu kills more people, yada yada." I mean, how do you respond to that? What do you say to those people?
Well, I think the reason that people think it's just like the flu is because the symptoms are similar to flu symptoms. But what I want people to really understand about this is that it's a novel virus. So we don't know a lot about how this virus is going to behave in the future. With the flu, we know it's seasonal. We know how to treat it. We have vaccines for it. We adjust those vaccines every year so that the new vaccine next year will give us better protection. We don't have any of that information with this virus, and that's what makes this different.
Right. Obviously, the response really ramped up this week. I think it started, I would say it kind of started on Thursday. It didn't seem like much was really happening in terms of, the information was starting to come out, but it seemed like Thursday is when, like, the governors took the first step in action, and then that was followed by President Trump making his own declarations, and it kind of ramped up, especially this week. It really ramped up. What do you think about the response? Do you think it was enough? Do you think it happened soon enough?
I think that I totally agree. It had ramped up. When you look at last Thursday, I think we had 7 cases in Wisconsin.
Right.
As of yesterday, DHS said we have 106. So that's in less than a week. So I think that the measures that have been put in place about closing schools, creating the kind of forcing the social distancing by closing restaurants and bars and places like that. I think all of those measures are necessary and needed, or our 106 cases are going to be 400, and we don't want that. And social distancing is key to stopping that. So I think what has happened has been really hard, but it's been necessary.
Right. And the 106 cases, today at 2 p.m. we'll get a new update. And for folks who want to check that out yourself, the Department of Health Services has a dedicated COVID-19 page where they update every day at 2 p.m. at the latest. We were just discussing it's usually pretty close to that 2 p.m. mark, maybe 10 minutes early, but they say by 2 every day they're going to update it, and we've been following it. It's been a little scary to see it jump and to get a little bit closer. Closest is Wood County, if I'm correct, right? Yeah,
the closest identified case we have as of right now that I'm aware of is Wood County.
And that was, I think, a couple days ago, 2 or 3 days ago?
I think that was released Monday morning, but my days are kind of running together right now. So, but it's been a couple of days, yeah.
Yeah, so far only that one case in Wood County. Didn't look like it has expanded from watching the Department of Health, but most of them seem to be in the Milwaukee and Madison area, or Milwaukee County and Dane County area.
Milwaukee County,
Fond du
Dane
Lac.
County, yes, and Fond du Lac as well.
And a few others in like Waukesha and kind of the southern part of, kind of that southern L of the state, so to speak.
Right. The thing that is interesting that's been happening in Milwaukee and Dane County, and I think Racine County as well, is that now we're starting to see what we call community transmission, which is where people are showing up COVID positive and we can't link it to another case. So that's another indicator to us that this is widespread, and it reinforces the need for social distancing.
Yeah, definitely. Well, my understanding now, just saw that yesterday, apparently they've started developing a vaccine. Have you heard a little bit about that?
I've heard a little bit about.
I think the first phase trial of the vaccine is starting.
Yes, and there's been work on vaccine for a while now, and there's dedicated effort to trying to bring that up as fast as possible. Vaccine development takes a long time.
Right.
we won't have a vaccine for people for at least a year, if not longer.
Yeah.
There's a lot of testing that needs to go into that. I mean, we need to make sure it's effective because we don't want to give something to people that's not effective. And we also need to make sure it's safe.
Right.
So while people are, like, get the vaccine, hurry, make the vaccine, we will. There are
Right.
folks working on that, but we need to make sure it's safe and effective.
Yeah, the way the health expert that was on the Joe Rogan podcast a week ago, and he's from the University of Minnesota, what he was saying is like, well, it's not so much making the vaccine. We could do that, tomorrow. I could make a vaccine for you tomorrow. It's the testing and the
Yes.
making sure you get the dosage
Yes.
right. And so
Yes.
that's the part that takes the long time.
Exactly.
Like, you could make one right now and not test it, but you might kill a bunch of people. It
Right.
could be really dangerous.
Right. And
Yeah.
we don't want a vaccine that's worse than COVID itself.
Yeah, exactly. I want to talk a little bit about social distancing because I think a lot of people might not understand what that means exactly, and I think there's maybe different interpretations of it. Can you talk about like what the best practices for social distancing are and how people can implement them?
Social distancing is a critical factor in controlling the spread of this. And so this is the first thing I want everyone to think about is how can they do this and try to do this as best they can.
Right.
Social distancing is about limiting the amount of time that you're with other people, the closeness of how the distance between you and other people.
Yeah, we're probably violating that right
we
now. aren't
Probably
we?
are. What's recommended is 6 feet, and we're probably more at the 3-foot range.
Yeah, we're
so
taking a risk for you viewers at home.
And we are both asymptomatic and we are both
Yep.
healthy. So keep that in mind. So social distancing is about creating distance between you and other people. What we're really trying to do is control the spread. And this works no matter if you're talking about regular flu or COVID or a cold. The more that you can separate people, the more we're going to create a barrier for that virus to move from person to person.
Yeah, and I think it's definitely harder for some people than others, depending on what your employment is. I mean, I can probably work from home, and I think after today I probably will be. Our office building is shut down too, so like we can get in because we have access, but no one else can get into Washington Square right now because it's closed down, which is good, I think. Some people, I feel bad for people who work the kind of jobs where you can't work from home. And they either have to, especially I'm really feeling for, people in the bar and restaurant industry.
Absolutely.
I mean, they're sitting at home right now and they can't work. I don't know what's going to happen with them. I'm glad to see there's a lot of relief efforts going on right now. That will hopefully help. But there's going to be some pains, even at my own job. We're taking a 20% reduction in hours. So, and our papers are you probably saw this week's paper is only 16 pages right side up. And I think future ones might even be a little smaller. So it's a challenge, but at least on the terms of, and we were kind of talking a little bit about this before the podcast, but at least in terms of like ways to entertain yourself or keep connected with people, it's kind of good that it happened now and not 20 years ago because there's more ways to reach out to people. I was just telling Judy that, I did like a 30-minute yoga thing with a gal in Brazil this morning on Instagram. I mean, you couldn't have done that 20 years ago, right?
Yeah. Yeah. And so the technology that we have is enabling some people to work from home, which is great because that assures income for people, some people. But it also helps us connect to people. And we don't always have to be face to face. It's a means to help that social distancing, and
Right.
that's really important. But I want to circle back to your comment about the businesses that have had to close because I really want people to know that the changes that have been put into place and the governor's declarations about closing businesses is really all about protecting and stopping the spread of this. And those decisions are never made lightly.
Right.
Leaders are thinking about the economic impact of this. At the federal level, a stimulus bill was passed yesterday, and so there is, there is an attempt at the federal level to try to help small businesses and try to help a number of different aspects of the community. So it's not being ignored. And the more that we do faster in terms of social distancing and stopping things now, if we do this really well now, we won't have to do it as long.
Right.
If we wait until we have widespread disease across the country, then it's too late, and then it's going to take us longer to recover. So I know it hurts right now, but it is so necessary.
Do you think these measures could get more severe? I know, like, do you think they could get to the point where, like Italy, where everyone's kind of like locked down under, like they almost have to all stay home?
If everybody does their part in social distancing, staying home, following those directives, I don't think we need to get that far. We might see isolated communities where that needs to happen. We've seen it happen in New York already.
Right.
So there might be communities that need to do that, but we're only going to do that where it's widespread community transmission. So what's happening in Milwaukee and Dane County right now is a little concerning because they're having that community transmission. So it could be that we see specific geographic areas go into those kind of lockdowns. But again, if we all do our part, we can prevent the need for that to happen.
Is that kind of the threshold, community transmission versus like person to person, where you know? Because I was just thinking about like when we're watching the numbers, like are there certain rates that we should be looking for where the cases only went up by 10%? That means we've turned the corner, or I don't know if you are aware of any of that or what you could say to that.
Well, I can't give you a specific number because I don't know what that's going to be, but obviously when we see, it's similar to when you look at data and charts about flu. You'll see cases go up, 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 and at the beginning of the month, for the first time this winter, we saw that curve start to tip and come back down for flu virus. So, we're watching and waiting for that with COVID, and I don't think we're going to see that really soon, but that is something that we watch for, as well as that community transmission. That is a critical factor in decision making.
And in our interview, you talked a little bit about what people should do if they start feeling like they have the flu. And one of the things, I don't remember if you had told me or someone else, I read this somewhere else, but one of the things that someone mentioned was that the flu season is starting to wind down. So if you start getting symptoms, there's a pretty good chance that might be COVID-19. But you were talking about what you should do if you notice illness symptoms.
There's still we've seen the flu season begin to end, but it's not ended.
It's not gone yet. Yeah.
So if you have symptoms, we have a lot more seasonal flu out there right now than we have COVID in our area. So if you have symptoms, whatever they are, please practice all of the measures that we've been asking for COVID, but do it for seasonal flu and colds. Wash your hands, practice the social distancing, use hand sanitizer, stay away from your friends and family as much as you can, isolate yourself in a different part of your home, do those kinds of things because anything you can do to prevent the spread is going to help.
And at what point should you contact a medical provider? Like, do you advise people when they first notice it to do so, or only after it gets to a certain severity level?
I would say if they have a fever.
Fever, okay.
A fever is a good indication of something a little bit more serious. And then all of our hospitals have call lines and... Excuse me, not hospitals so much, but the clinic systems. All of our major clinic providers have call lines. So the first thing you need to do is call that call line and talk with a provider who's going to ask you questions that will help them determine, do you need to be screened or can you stay home and get over this? We do all the time have colds and have flu and stay home and take care of ourselves and treat it ourselves at home and get over it. Right. That healthcare provider will help distinguish, should you be tested or should you stay home? And those will be taken on an individual basis.
Yeah, because I think you were saying the last thing you want to do is just show up at one of the clinics or the ER.
No, you don't want to do that. Yeah. You don't want to do that. We have a lot of, our healthcare system is really strapped right now. Yeah. They are working at capacity and it's very difficult for them. And so in terms of social distancing, please practice social distancing by not showing up at the clinic with your cold and flu symptoms. Call first. They will help. If they decide that they want to see you, they're going to help direct you into their system in a way that protects their other patients.
Yeah, they'll have a real specific way for you to do that so you're not spreading,
Absolutely.
I can just only imagine what a worst case scenario that would be to have someone
Yeah.
with COVID-19
Yeah.
come to the hospital
Yeah.
and give it to everyone else.
Yeah. And don't forget, you've got other
yeah.
people that are in those systems for other reasons, right?
Right.
So they might have a different condition that brought them into the healthcare system. And then
Right.
you show up with a cold or a flu or COVID. Well, that's adding insult to injury. We don't want to do that.
Right, and I think as I recall, the populations at highest risk are the ones who have an autoimmune deficiency,
Yeah.
or of autoimmune disease, or the elderly people, and those are the people you're going to find it mostly at the hospital. So
They tend to be there more
yeah.
frequently,
Yeah.
and so you can do a lot to protect their health by being smart and calling in advance and
Right.
getting that guidance.
Well, what has this been like for you guys at the health department? How does this ramp up, and at what point is it like all hands on deck? I mean, how does that look like from your guys'
Yeah.
perspective? Because I think a lot of people don't think about the county health department that much on a day-to-day basis.
Yeah, they don't necessarily think about us because we're small relative to the other healthcare systems.
It's probably good, because that means nothing's going wrong.
Exactly.
Right.
When you see us, you know that there's something big happening. So what it's been like for us is in the last couple of weeks is just a steady ramping up of what we're doing. So we have our public health nurses are all of them are working on following up with anybody that's been tested to help them understand what they need to do, what their risk might be, what they did have, what they don't have. Right now we don't have cases, but this disease is what's known as a Category 1 disease in our world, which means we have to respond quickly. And so for our nurses, that means all hands on deck working with people to help them. My team has kind of been redirected to communications, helping answer questions. And so we've been busily manning phones. And then all of the other pieces that have happened, we're working with our partners. So when schools were thinking, should we close early? When funeral home directors are thinking, what do I do about this gathering? Can I do this? Should I not
Right.
do this? What is the directive? What does this mean for me? We're trying to provide some guidance to other leaders of other organizations on how they can best respond. So it's been we've stopped doing a lot of our regular services, and we're not everyone is working on this all day, but we're getting there. We're getting there.
Wow.
We're planning for ramping up where everyone will be working on this full time.
So this is kind of more of a fun question, but like, what kind of things do you do in your free time when you're when you're practicing social distancing?
Oh, well, I have to admit I've been pretty busy lately. So my free time is, I go home. I've been working longer days, so I go home and I have a meal with my family and we talk about the day. And then sometimes I turn into the news, because I'm kind of a public health junkie on this. So I've got to
Right.
know what's going on. I got to hear what's happening in the world news, and I don't always get that during the day.
Sure.
So I listen to a little bit of that. I read. I shouldn't say I wish I could be quarantined, but I am thinking about all of the things that I would do if I had to stay home for 14 days. Like, I want to learn how to knit. And so I could go on YouTube and watch how to do this, and I could teach myself how to knit. And so that's those are the things that I've been thinking about. I'd like to be able to do
Right.
is read the books that I haven't read, watch the movies that I haven't read, play board games with my family, and do those kinds of things a little bit more. So
Nice.
and when the weather turns and it's supposed to get a little nicer next week, get out and enjoy it.
Yeah, I mean, you can still be outside, right? Like
Oh,
when
absolutely.
running
Absolutely.
Yeah.
Just not in large groups, but, take the dog for a walk.
That's perfect.
Good for you.
I did last night. One of my friends hosted a watch party on Facebook, and it's kind of cool because he picked he had kind of a playlist of movies, and you could just join, and you could watch the movie, and then you could comment on it.
Oh,
So
fun.
we were kind of and we were watching old 80s movies, so we were kind of making fun of some of the stuff.
Yeah.
It was a lot of fun. It was a way to kind of build connection, and I actually thought it was more fun than watching a movie in person, because then if someone talks over it, they're talking over the movie. This way, people can choose to, you can make the movie full screen, and then you're not seeing the comments, and then if you see something funny, you can go back and collapse it entire. I was more hooked on it than I would have expected.
Yeah. And that's the good thing about this happening at this point in our lives is
Right.
that we have the ability to connect with people in ways that we didn't have before. And so, I encourage people to use those things. They are a critical element to maintaining that social distance.
Definitely.
Yeah.
Well, Judy, is there anything else any final message that you would want to send to people about the coronavirus, about COVID-19?
Yeah. My final message to everyone is that every single person has an ability to help slow the tide of this. And if everybody does what we've been asking people to do in terms of, infection control, washing your hands, those sorts of things, and practicing that social distancing, we can slow this down. So if you think it hurts now, if we don't nip this in the bud, it's going to hurt more.
Yeah.
So please help us. Please practice the things that we've been asking. Take control of the situation with us, and we'll get through this. And we will look back on this. It will be historic. We will look back on the interesting things that we did and the ways that we innovated and altered our lives, so that we can continue on together.
It is historic, and it's really felt a lot like 9/11 to me. I was 21 when that happened, when 9/11 happened, and it kind of felt like you were living in a movie, like it wasn't real. Things just felt surreal, and this coronavirus has felt similar, except I think before the podcast we were talking a little bit about the difference was that was more acute, like it happened, boom. And then the rest was reaction.
Right.
This has been more like the frog in boiling water.
Yeah.
And it's like it's kind of crept up on you. At first it was like, well, it's that thing that's happening in China. It's like, oh, well, it's starting to get in the U.S., but, it hasn't really impacted my life
But it's on the coast, so we're okay.
Yeah, right. Then it was on the coast, and then now once it started hitting Wisconsin, and now, last week, things really ramped up, like we said, and especially earlier this week is when stuff really started really having an impact.
It's a bit of an eerie feeling to walk down the aisles in the grocery stores and see, empty shelves. That's not something that we as consumers are used to. We're used to an abundance. And so to see that is a little unnerving. So, but don't let fear take over.
Yeah.
We will get through this. We can take control. Every single person can do something about this, which is that social distancing, planning ahead. And take the time that you have and think of it as a gift to spend time with your family, to do things that you normally didn't have time to do before.
Right.
I can't tell you how many times I would say, I would be in better physical shape if I had more time to work out. Well, you might have more time now. So take the time, use it wisely, and help us, and we'll get through this.
I agree. Yeah. Yeah, I think I think the rational response is, don't give in to fear, but also do the things that we need to do to combat this. It's a nuance, and our society isn't always great on nuance, but this is one situation where I think a rational and nuanced approach to this really can help. So, Hey, Judy, thanks so much for being on. I think the folks at home, we're going to demonstrate a Corona bump.
All right. There you go.
There we go. That's how it's done. So I always end the podcast by having my guests say, keep it Wausome. So keep it Wausome, Judy.
Thank you.
And you guys keep it Wausome. Yeah. All right. Keep it Wausome, everyone. Stay healthy. I hope you've learned a lot today. And make sure to like and subscribe if you're watching on YouTube. If you're listening at home, give us a thumbs up or a nice review on Spotify and iTunes. And again, I hope you learned a lot. This has been presented ad-free because I want you guys to get the information. So also pick up, we talked about the coronavirus itself mostly, but if you want to learn more about how it's impacted, make sure you check out City Pages this week. We've got pretty much the entire paper has been devoted to City Pages coverage. I'm BC Kowalski, and this has been Keep It Wausome. Thanks so much for listening.